nurse is a practitioner in their own right. It is the nurse that does the assessing, planning, implementing and evaluating of care. And the nurse is the one that focuses very much on the person as an individual. We are the one that's with the patient 24/7.
I never really considered nursing before as an option, but it was once when I was in A&E with a broken arm. I was quite shocked and surprised to see that it was a male nurse who was caring for me and looking after me, and it really left me an impact on the role of nursing, and it gave me such admiration and respect for the role. But it was only a few years later, while talking to a career advisor in school, did they say to me, here, nursing could be a job and an option for you. And ever since then, I really just thought about it and decided, you know what, this is the role for me.
I decided to do nursing as a career when I left school and I started working in the community as a domiciliary worker. I worked there for about 4 years and it was just, I loved helping people, I loved how I felt doing it, I loved to see the change in people.
I've always been drawn to caring for people and interested in it. I think it's a big part of my personality. It just comes naturally. It's, you know, even in a non-professional context, you know, friends, family, I'd always do what I can for them or help them.
So I suppose I was motivated to do nursing as a career. I've always had a passion for caring. And then when I was quite young, my father was in a serious motorbike accident. So that involved a lot of trips up to see him in hospital and seeing the whole situation and the nursing care. And I was just fascinated by it. I just loved seeing it all and seeing how he talked about the nurses and how much they made his hospital stay so much better, and the nursing and the medical staff saved his life really. So there was that, and then the whole community care as well, seeing the nurses coming into our house and seeing everything they were doing, and I just loved it. I was so interested.
For me, the biggest motivation was I went through a massive life experience of losing my brother in a car accident, and that motivated me because I seen the nurses working on my brother and the struggle that was, but at the same time seeing them work on him, seeing what they were capable of doing, it really wanted to change my life around to be something to help in that situation, and to be able then to do that for other people who have been in the same scenario.
I chose nursing as a career because I had a lot of experience working with adults with learning disabilities, both in my job and also in voluntary sector, and that led me to believe that that was what I wanted to do. But in that respect, I wanted to make more of a difference. I wanted to choose a career that I could give back a bit more, and that's what motivated me to choose learning disability nursing.
I find nursing is an excellent career for everyone, boys and girls. If I look at my own example, the opportunities that I've had from joining the course until now have just been amazing. I've had opportunities to go all over the world and to practice my skills that I've learnt.
Person-centeredness is really important, and what we're looking for are those individuals that are kind, and whenever you come to us as a nursing student, we will develop those skills, we will give you the knowledge and the skills in order that you become that caring, competent practitioner. And that career is suitable for both boys and girls. So if you have an interest and you have that caring attitude to life and you're kind, nursing is a career for you.
When I was in school, nursing wasn't something I considered. It wasn't a choice that was put forward by my careers teacher, but after a few years and life experience behind my back, it's something I kind of regret that I didn't do sooner.
At school, I wasn't really aware of nursing. I especially wasn't aware of learning disability nursing. Nursing was something that came as an option whenever I was doing a degree in health and social care, but it was put across as general nursing, adult nursing. I was never made aware that there were different streams of nursing. You can study adult nursing, children's nursing, mental health or learning disability. And once I found out that learning disability nursing was an option, then that was me, I was set on that.
When I was in school, like I think every female in the class was asked if they wanted to be a nurse, and you know, it wasn't something that was talked about to fellas. And you know, when they looked at my A level and what I'd chosen to do, it was like, oh, he's going to be an engineer, and you know, it's not always the case. You know, nursing takes in so many different subjects, and it doesn't matter how obscure they might be, you can find a link to nursing somehow.
A teacher just said to me, you'd be good at nursing, and I took that opportunity and thought, why not? And I've really enjoyed it ever since. There's always the caring and compassion and the things we already know about, but what the teacher's seen in me was that I was able to coach hurling. I was able to take children and I was able to show them something, and then I was getting a lot of satisfaction to seeing that they were learning new things. So it was that ability that I loved looking after people. I loved looking after children. So that's what this teacher had seen in me.
Nursing's unique in the way that you're in class for 6 weeks and then you're on placement for 6 weeks. You know, I don't think any other courses do that. You have to wait 2 or 3 years to get a placement or something like that in other courses, whereas nursing, you hit the ground running and you can really see yourself becoming a nurse week by week and fitting into the role.
The 50-50 split between practice and theory is so helpful, and getting the chance to take aboard all your theory and then go out into clinical practice and meet real people and use all your knowledge on them, and also meeting the medical staff and the nursing staff who will be happy to show you anything you need to know, and learning amazing skills from them. People that have been practicing for years in their field is invaluable.
The diverse aspect of, you know, academic teaching and then placement is perfect. It's the 50-50 balance. Yeah, 1 minute you're in class and the next minute you're doing what you learned in class in a clinical placement. So it really helps, you know, cement the learning that you've done in class to be practical with it. And I think, you know, having 50-50 is perfect. By the time you're coming out of the course, you're a fully competent nurse because of what you've learnt in class, side with the placement aspect of it all.
I think the academic and the clinical side of the course go hand in hand. I think you learn so much when you're out on placement, but you wouldn't have any of that without the theory. I think the lectures make it really engaging. I think it makes it really interesting, and it really sets you for when you do go out on placement, because you're not surprised by a lot of the things that you see.
Personally, I found that really helpful, because you learn your theory and then you're really excited to go out on placement and put that into practice. And then of course, while you're on placement, you learn lots of new knowledge and skills, and then you come back to theory and take that information and build on it more, and the cycle repeats. So personally, I find it really, really helpful and really beneficial to my education.
I find all the lecturers are very, very knowledgeable, and they all know exactly what we're going through on placement, because most of them have been or are still practicing nurses or in the healthcare side of things in some way, and that's so important, I think. There's such a wide variety of teaching methods offered as well. You could be in the clinical skills room, hands-on learning with a dummy, a simulated dummy, which is really helpful because you can take blood as many times as you want and not hurt them. I've really enjoyed the course delivery, everything from face-to-face tutorials or online learning, Microsoft Teams, podcasts. There's something for everyone's type of learning.
The teaching, I think, is really good, that they incorporate a lot of different learning styles. You know, it's not just sitting in front of a lecture and you take notes. You know, there's interaction, there's games, there's linking it to real life scenarios instead of textbooks, you know, and it all just blends really well together. A couple of positives coming out of nursing is, you know, you don't have any student debt, no fee, you don't have to pay any fees yourself, it's all covered. You also get a bursary that you don't have to pay back every month to help cover the costs. That, coupled with the fact that you're more or less guaranteed a job at the end of it, is just a load off your mind. Like, I can imagine a lot of people stress about that kind of stuff, and nurses, it's all taken care of, you're looked after.
I appreciated the different resources that are used for people's different learning needs. I think it really includes everyone. You have podcasts, you have different reading. I think the lectures make everything really engaging, and they meet everyone's needs. And obviously the support's brilliant. You just know that if you want to reach out, they're there for you. And I think that makes all the difference.
The lecturers that are around you are people that have been through that, and they're teaching you from experience. They're not teaching you from a book. They're teaching you what they know, what they've experienced themselves. So the teaching side of things is always refreshing because it's coming from a perspective of, I know what I've been through and I know what I've gone through, and this is how you should be able to go forward with it. Queen's gives itself to really be sociable. You have so many avenues of different clubs and different societies that you can be a part of, and I think like within that I was able to be a part of some of those clubs and societies, which was massively beneficial to meeting new people and meeting people of like-mindedness. And I think Queen's itself is really good at encouraging that.
I've been very lucky in all my placements. I've loved every single one of them and met amazing people in them all. My third placement of first year was probably my favourite so far. So it was a surgical ward. So it was ear, nose and throat and head and neck cancer. So lots of different things and quite seriously ill patients, but the team were amazing, and even dealing with those critically ill patients, you've always got a very supportive team, and that's what helps. And I learned so much there. It was really invaluable.
The thing that left with me the biggest impact was an experience with a palliative care nurse, a specialist practice nurse, and seeing them work in their job and seeing them coming to the patient and seeing where they're at with almost at the end of life, and the care that they were able to give to that patient was amazing to see, and something that I hope in the future to aspire to be.
I loved my A&E placement because I think I deal well under pressure. I love the chaotic environment. I think everyone gels well together as a team, and I appreciate that everyone knows their place and what they're meant to be doing. I really love that everyone supports your learning, everyone wants you to do well, and they get you involved with every learning opportunity. So that's what I loved the most about it, was everyone cared about your learning.
Placements are amazing because personally for me, each one of mine have been unique and I have learned something different in each one. For example, I've had placements in a COVID ward, I've had placements in a mental health ward, I've been in a cardiovascular outpatients clinic, and I've been in fracture rehab. Each one of those I have learned new skills and new knowledge which I'm able to take forward in my nursing career. I always had a high regard for doctors and those in the medical caring nursing profession, but I just suppose obviously being a male, it never crossed my mind. You know, your children's books or TV shows and just the stereotype, it's only girls that can do nursing. There was a few members of my family, again all female, who did nursing and who loved it. So as I said, it was something I always admired but just never thought I could do. And I always thought that would be such a cool job.
Being a male nurse definitely brought a different dynamic on some occasions. For the most part it was more or less the same, but I think especially when it came to male patients, it was easier for them to open up to me or build a relationship with me than maybe my female colleagues. I would definitely encourage more males to even consider it. I know like even my friends and stuff would never have thought about it or anything like that, but I think everyone should consider it at least once properly, and you'd be surprised, I think.
I see it as something that I can work towards, that as a male nurse, that I give a fresh perspective to a lot of females who are already in the environment, able to give what would a male do in this situation, give ideas that maybe nobody's been thinking of before. So for me it's a good challenge. It's kind of refreshing to give males an option to give them a shave and be able to talk on a I don't know, basis of male to male, talk about football, talk about those things in life that maybe a girl wouldn't want to talk about.
I think it's very important to have obviously girls and boys in nursing, but when you think of the people that we're looking after, I think for the population, obviously for the male clients, patients that we have out there, it's very important to have a good number of men, so that, because there is that interaction that's so important, isn't it? You know, between males that maybe females don't understand.
My future career in nursing is going to hopefully look like qualifying as a Band 5 nurse, and then I would also like to go on and do my Masters in mental health nursing. I would like to take that then into working in prisons as a mental health nurse. And it's something I'm quite interested in, is providing support, physical and mental health support in prisons to prisoners. I feel that's an aspect that's quite neglected sometimes, and that's something I'd like to improve in prisons.
Looking forward, once I qualify as a learning disability nurse, I would love to work within the community sector. I had one placement within a community nursing team and I absolutely loved it. I loved the variety of it. I loved getting out and meeting patients and getting to build relationships with them, because we were working with the same patients on a regular basis, and so that's where I could see myself.
A&E is somewhere that I see myself working in the future. I love the fact that each day you don't know what you're going to face, that there's new challenges all the time, and I also enjoy working under a bit of pressure. But I'm also really looking forward to experiencing new placements throughout the remaining of my nursing course, and maybe I'll see somewhere else that I would love to work in.
My dream as a nurse would to be a specialist practice palliative care nurse, working with people at the end of life, which is not the most pretty or the most nice nursing job, but I think there's a massive privilege in being there for someone at the end of their life.
After my placement in A&E, I've decided that when I qualify, that's where I want to go and work. I love the fast-paced environment, love how busy it is. I love that you're doing something different all day, every day, and I think that's where I'm going to end up.
I think this is one of the positives to nursing. You know, I've had so many different experiences in this year alone, and I could pick any one of them to sort of go into a career and follow through on. And I've got another 2 years of even more experiences, and that's a great thing.
Nursing is a very good career to come into at the minute, and particularly here in Northern Ireland. We're very fortunate in the Department of Health are paying our students their fees, their university fees. They're also getting a bursary, and at the end of the 3 years our students are guaranteed a job. There is a shortage of nurses at the minute, so we have no issues in relation to employment. If you're successful in the programme, you'll get a job. I do think anybody applying needs also to understand the nature of the programme, in that at the end of the 3 years, not only will you get your degree, but you'll also be registered with the Nursing and Midwifery Council. So it is a full-time course, but at the end of it, you're getting, as it were, 2 qualifications for the price of 1.
If you feel that nursing's for you, why don't you follow it up? Why don't you go to your careers teacher, go to Queen's University website, ask someone, there's plenty of people who know nurses, ask them what the career's about and go after it. Don't let anyone stop you.
I would say if you're thinking about nursing, go for it. You've got nothing to lose. If you really want to do it, just go for it. Don't listen to what anyone tells you, no matter who you are or what background you're coming from. If you think you're caring, compassionate and you're passionate about nursing, go for it.
If you like a fast-paced, ever-changing environment and you don't want a mundane career, then pick nursing, because it'll challenge you all right and you'll love it, you will.
I would definitely recommend a career in nursing. I know people have that thought in their head that it's just bedside nursing, but there's so many, it opens so many doors for you. There's a part of nursing that will be for everyone, no matter what specialty you want to go into. I think I would definitely recommend it.
Even if you've never considered nursing before, I would say it is such a diverse and amazing role and job. There's so many opportunities in it. I would say to somebody, if you know someone who is a nurse, go speak to them, find out more, find out what they work in and what their daily role involves. Speak to your career advisor, look up information online and just learn as much as you can and see if it's the job and role for you.